Yeah.
So when you're putting the braces on, I think straight leg is a good visual for you, so you can see where it is and what way, correct placement. When you're going to adjust the unloading and use these dials, I want you to bend your knee. So
Okay.
in this position.
Okay.
Now, the unloading. Do you see these windows right here?
Yeah.
And do you see the little dots next to the window?
Yep.
Okay. The little dots signify the amount of unloading that you're doing.
Oh.
Now, we don't know how much correction you need. So we don't want to guess, right? That's why you're leaving with some homework.
Oh.
And some safety reasons for this are as we're making because we're making a physical change to how the joint is positioned, we don't want to go really far, really fast, because the brain could register this sudden large change as an injury. And then it could send signals to from the brain to the knee to protect and stabilize, perhaps in the form of muscle spasms to try to lock it down. We would like to avoid that for you.
Okay.
All right. It's also possible to overcorrect.
Oh.
Right. So
yeah.
as we're tipping the knee, as we're gapping this lateral joint space, it could go too far and then pinch the medial joint space and narrow that. We would like to avoid that. So your homework looks like this. So you turn clockwise turns. Okay, that's how you increase that little blue marker inside.
Yep.
I'm gonna put it on dot number 2.
Okay.
And I'm gonna do the same thing on the bottom. Okay.
No.
Okay. And then this one is just yellow instead of blue. We're gonna put it on dot number 2
Okay.
and dot number 2. Now, this is just our jump off point. It's not necessarily going to end there.
Okay.
Also, keep in mind, you have 2 braces, 2 knees. They are different.
Oh.
So they do not have to end on the same numbers.
Oh. Okay.
All right? So
Okay.
keep that in mind. They're separate entities.
Okay.
Treat them differently.
Okay.
Okay?
Yeah.
So, your homework looks like this.
Yeah.
You're going to wear the braces at this setting for 2 hours of time
Okay.
with use. Test the braces.
Okay.
Not sitting at a desk or in a car or on your couch, right? Not being sedentary. Use the braces. 2
Okay.
hours.
Okay.
Take the braces off and you're done with them for the day. And you have to self-assess and kind of self-check of how do my knees feel, right? Is there improvement? Or is it kind of same what you've been dealing with, right? Aches, pain, soreness, all that stuff. Let's say hypothetically, there's no real change, all right? So same. The next day, you're gonna put the braces on. You're gonna increase your dial to dot number 3.
Okay.
All right, top and bottom.
Okay.
You're gonna wear the braces for only 2 hours again. So testing the braces, try to be active.
Okay.
Take the braces off, do your self-check. Let's say hypothetically at that time there is marked improvement and there's a positive response in the knee. Now I'm speaking kind of singularly, but you have to assess out for each individually. Does that make sense?
Yeah.
Okay.
Yeah.
So let's say there's a positive response. That indicates that setting, that the number 3 is good for you. All right?
Okay.
So the next day, because you had a positive response, you're gonna keep that setting and you're gonna increase your wear time to 4 hours.
Ah.
Okay?
Next day?
The next day.
Okay.
Right? So day 2.
Okay.
So you're gonna wear it for 4 hours.
Okay.
And do your self-check, still feeling good. Do 6 hours the next day, 8 hours the next day, 10 hours the next day.
I don't work 10 hours.
That's fine. That's a great question. So as you build your hours, it's unrealistic that you're going to be running around and walking for 10 hours straight. Okay?
Yeah.
Just keep the braces on.
Yeah.
Try to incorporate stuff, live your life though.
Yeah.
Like with work and your life, you have kids.
Yes.
Like kids stuff, all those things, right?
Yeah.
So but have the braces on.
Okay.
All right, that's the goal.
Yeah.
It's acclimation.
Yeah.
All right. So once whatever number you've landed on that is eliciting your positive response, once you build to that 10-hour wear, you've completed the homework. So from there, even if you don't intend to wear this all day in the future, we recommend you build to that all-day wear because it's the most accurate way to find out which numbers what settings you need. Yes?
Okay, yeah.
So then from there, you finish the homework, you wear the braces as much or as little as you see fit.
Oh, okay.
There's no wrong answer there.
Oh, okay.
Some patients live in these. Wake up, put it on, go to sleep, take it off. And others I only wear this when I play pickleball.
Yeah.
Right? one event.
I go hiking.
There you go.
I go to gym. I do squats. I can't do squats, but with those I can, right?
Theoretically.
Okay.
Right?
Yeah,
and
yeah.
so that's going to be a test and see. A lot of this is trial and error as well, and kind of like.
Okay.
your
I'll wear
feedback.
this to the gym. And,
Right? Yeah, absolutely.
and I'll do squats, see the setting if the setting works.
For sure.
Yeah.
Yeah. I mean, like, give it tries. The things that you typically, or like things that you want to do but are typically limited in.
Yeah.
The braces theoretically should help you with that and allow you to do those activities. Now, will they 100% of the time? Maybe not. But you know, that's the hope, and that's the goal at least.
If I walk my dog,
Yeah.
I wear those.
Sure.
And it start to hurt. How do I know it's too much adjustment or it's just not enough? That's why it
Sure.
hurts.
So if it's too much adjustment, like I mentioned earlier, it's possible to overcorrect.
Yeah.
So if you go too far on the adjustment, you may feel unfamiliar pains or like foreign pains.
Oh, foreign
So
pains.
things that
Okay.
you haven't yet experienced.
Oh,
For
okay.
example, primarily, it would be on this side of the joint for you, right? If all of a sudden, if you adjust to whichever setting and you do your activities and you feel pain on this side of the knee, that is indicative that it's too much. So then you can just back it off, turn the dial the other way, and like kind of reduce a bit.
Okay.
You don't need to go back to where you were. You can kind of like halfway,
Okay.
right? And
Yeah.
does that make sense?
Yeah.
Okay.
Yeah. Good.